October is Breast Cancer Awareness Month, a time to raise awareness about the impact of breast cancer. While male breast cancer does not receive a great deal of publicity, Eric Dunlap is trying to change that in North Metro Atlanta. Dunlap is a longtime male breast cancer survivor who works to raise awareness across Georgia. What is your message for other men who are hearing this?
I want men to not just look at Breast Cancer Awareness Month as a month of awareness for women, but also use it as an opportunity to check themselves. Men really don't get mammograms. And so here's an opportunity for men to talk with their physicians, make sure that they are doing examinations themselves to ensure that if there's a lump or any discomfort in the chest area, that they're going to have it reviewed by a physician.
Dunlap was diagnosed in 2000 and underwent a radical mastectomy and simultaneous reconstruction surgery. He also endured months of chemotherapy. Dunlap's mother was initially diagnosed with breast cancer 4 years before he was. Dunlap also lost his grandmother to breast cancer. And what was it like for you as a man to be diagnosed with breast cancer?
Well, you're first in complete shock and I'm going to say denial. And I know I did not think of men really getting breast cancer. I'd only heard of one occurrence, and that was Richard Roundtree, the actor Richard Roundtree, that is. And um, he didn't talk about it a lot initially. And so when you hear that from a doctor, your questions are running through your mind. How could this happen? I've been pretty healthy. What are the things that I could have done to contribute to this? Did I do anything to contribute to it? And it turns out that, my grandmother had breast cancer and died from it when I was a small child. My mother would be diagnosed 4 years before I would be diagnosed with breast cancer. I didn't think of any type of hereditary link at that time. And the only concerns I really had was for my mother and my younger sister. Just trying to encourage my sister to get her mammograms in a timely way. And obvious concern with my mother getting diagnosed at the same exact age that my grandmother died. But at the time of my diagnosis, I had two small children, two sons, one 13 months old, Christopher, and my 3 year old, Jordan. And I didn't know when I first got the diagnosis, sometimes with cancer, you're given a prognosis at the same time. Sometimes that prognosis may give you a timetable on how long your lifespan may be from this dreaded diagnosis. And I remember telling the doctors I didn't want to know any prognosis of time. I wanted to be here for my children, and that was my plan.
Dunlap is involved with a number of area organizations, including the American Cancer Society and the Pink Frog Foundation.
And I've been blessed to still be here. Again, there were 7 of us getting chemo every 2 weeks during my time. And out of the 7, to the best of my knowledge, only 3 of us are still living. And although there were cancers in various stages, some breast, some otherwise, but the whole thought of families coming in after a while, the families that are coming in to see about their loved ones, as my family is there too. So you kind of get to know each other a little bit from those frequencies of visits. And it goes back to a promise I actually made to my grandmother. I didn't know how sick she was at the time. She was in hospice. But for me as a small child, it just seemed like a fancy hospital. And I was holding her hand and having a talk with her. And at that time, she really wasn't speaking at all. Her cancer progressed to such a level that she was really just kind of moaning, and they were giving her what I considered comforting medicines. And she said, she didn't say anything at first, and she was just kind of looking a little bit, eyes going in and out of focal, I guess. And I said to her, and we called her Nana. I said, Nana, one day I'm going to do something about breast cancer. And I just said, I'm going to do something about it. And I was 7 years old. And she opened her eyes widely and she said, I know you will. And those were the last words she spoke.